I can hear something calling. It's calling me every day. If taking a chance is a crime, then I've got hell to pay. I've been walking the streets in my mind, trying to find a new day. Keep on searching until I will find, until I find a new way. I'm gonna say something, I hope you don't mind. It's time to rearrange. I walk round in circles, I'm going nowhere. It's time to make a change.
Hey Jeffrey, how's it going today? Really appreciate you joining me. This has been a few months in the making. I appreciate your patience and your flexibility on scheduling. So thank you so much. And I'm really excited to have a conversation with you. And I think some of the things you're doing will resonate with a lot of people. So thank you.
Thank you for the opportunity. So good to be here and good to see you again.
Well, Jeffrey, let's start out with, would you mind giving a brief introduction of yourself?
Yeah. So obviously, Geoffrey Roche, I professionally have the privilege of leading workforce development at Siemens Healthineers, and then certainly do a lot of other work, all in the intersection of learning and the workplace, and then also education and healthcare. Also have three sons, and so proud dad of my three boys. They're all in preschool all the way up to fourth grade, and I was born and raised in Pennsylvania, but now live in North Carolina. And so I don't miss the winter as much, but we are getting winter weather this week. So it's interesting in some ways as well, but so good to be here.
Yeah, and you bring that up. I literally took my daughter to school today and it was like 17 degrees. And I used to like the cold. And now that I'm in my 50s, I can't stand the cold. And I think I'll be headed down your way sooner than later. I think it's about that time. Um, so, Jeffrey, I come from a healthcare research data analytics background, so that's why I was really interested, probably selfishly, to speak to you. Looking at your background, your website, things you're doing, a lot of things that jumped out at me that I thought were interesting. I kind of wanted to start here. When it comes to healthcare organizations, how can they leverage AI to enhance value-based care and help reduce costs?
Yeah. I think there is absolutely great opportunities to leverage AI, particularly in the space when we think about, repetitive types of things in our healthcare system. We think about obviously the easy spaces is in the finance space, but certainly even in the IT areas. In fact, if there's one area that I think AI should be further leveraged in healthcare, you think about the clicks that have to occur in an electronic medical record, the frustration that has caused, that the amount of time that it takes to click, 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 just to get to one space or the next space for a physician, a nurse practitioner, a physician assistant, or even a nurse, is a significant frustrating point. And it's actually been one of the things cited that has led to burnout. So I think there's great opportunities for us to create more efficiencies and really harness the power of AI in that space. The other space that has me super encouraged, and I see some great results already, is sort of how you further leverage AI to create more of a healthcare safe environment. There's great ways to really get at a higher quality, certainly a better healthcare system for all with those types of things. And then the final that I still think that there's great promise is really in the area of health equity. We still sit in a healthcare system that has a lot of inequities, and we sit at a time where actually, some of those important matters are also getting deprioritized in various parts of government. And we have to remember the importance of health equity. I'm not suggesting that we have an equal system here. I'm suggesting an equitable system. And so I see AI as a great potential way to also further leverage, detect, and notice things that, for example, maternal mortality among Black and brown moms. Significantly higher here in the United States. Should not be, frankly, when you think about our healthcare system, but it is. And I think there could be ways of AI leveraging in different ways of the healthcare system to help us better detect those situations before they become too late.
It's interesting that you bring that up. And, right before we started, I told you I had an outline that I'll usually end up going away from, and you got me away from it already. So, um, I know when you mention equity and we talk about AI, what I, from my background, what I'm really curious to see what you think is I've always felt that when it comes to maybe equity, maybe not even as much as with AI, do you think we are utilizing the data to its fullest potential? I feel like, and maybe not even to its fullest potential, I'll say it this way, maybe to its correct potential.
No. No, and you know this, and I think all of us, especially those of us that have worked in healthcare, understand. I mean, there's no industry that has the plethora of data like healthcare. And I think certainly we have made some really positive steps. But even if we look back during COVID, there were so many misses that we had from leveraging the data perspective. I know I was in Pennsylvania at the time and had the privilege of actually being a part of our Commonwealth's response to COVID as part of a senior team that was established in a public-private partnership by the state. And I can remember so many times saying, like, why aren't we getting this data or getting this data? And I can remember even our Secretary of Health at the time saying, I don't have the authority to get that data. And I remember saying, like, what? Like, how can we in this structure of a system not get that data and really leverage the power of it? And so, no, I think we have to really realize that, with the right protections for sure, and certainly the right approach, we've got to do a better job of harnessing the data, and it's really going to be the only way that we can truly move to a true population health model. And we're still in an in between, and probably a little bit farther than in my opinion, we should be much farther along than we are still today. And I think some of that is, as you know, in healthcare, we're so risk averse. We don't want to challenge the status quo always. And I think when it comes to these matters, we have to be willing to.
Yeah, you bring up a good point there, and I guess I'd love to get your take on this. For me, I feel like where we lack sometimes is, and I'm always preaching this to people I work with, right? I feel like it is so important when it comes to healthcare data, especially, that we really have to keep it extremely unbiased and
Mhm.
allow it to tell the story that it's trying to tell. Do you feel like we're missing that? I feel like that's our biggest miss right now.
100%. And I think part of that is that protection kind of, I mean, I look back at my days and look, I get it, risk management, compliance, legal, very important roles in healthcare. But I think sometimes we have to share the facts as they are to be able to really understand how we either fix it or solve for it. And I have often found that sometimes I think we hide behind those things for fear that it's going to lead to something that could be negative or adverse. But ultimately, it's sometimes in those situations when you allow the full story to be told that you actually get to an outcome.
Yeah, I think it's definitely needed. I think we're getting closer, honestly. I really feel like we are. Um, Also then when it comes to that, what do you think? And you mentioned equity, right? Outside of the patient population, right? What kind of strategies you think can be implemented to create that equity, and maybe equity could be the wrong term, but that sense of purpose within the healthcare workforce and even in the healthcare education system?
Mm. Yeah, so let me kind of take first the health equity part of that. I think if there's one area of our healthcare system that still has to really further advance in a way that can drive equitable outcomes, I would say it's on the payer side. I mean, there's so much data, so many innovative things, particularly in a system that still has a very strong commercial type approach that we should be much farther along than we are, frankly. I mean, when you think about it, there's been a lot of pretty interesting and actually impactful work done in Medicare in many different spaces. And sometimes they've been pilot projects, sometimes they've been demonstration projects, not as much at times on the commercial side. And, again, what may be driving that, profit, lots of different opinions. But ultimately, I do think that there's great opportunity to harness and leverage some power there with hopefully some really positive outcomes. I think when we talk about the workforce, we have to really kind of sit back and reflect on the fact that we talk a lot about, even for example, we've had a very large emphasis in many healthcare systems for the last few years of really having a workforce that actually reflects and resembles the patients that they serve. And that has been studied time and time again. And it does suggest, study after study, that there is great benefit from a health equity, from a health literacy standpoint. But we also have to be honest now that there are some executive orders that have been signed, by the president that are causing some healthcare systems to say, well, we may not be able to do some of that work because they are technically a Medicare contractor through, the work of Medicare. Now, I personally don't believe that it would serve anyone well to retreat on those areas. We've got to continue to have a workforce that reflects the patients that we serve. It's so important, and I always go farther than just calling it, being a culturally competent workforce. We have to truly be, a team of physicians, team of nurses, team of MAs, team of physician assistants, nurse practitioners that can truly deliver evidence-based medicine and practice, but at the same time understand the needs of their patients. And it's difficult to do that if you don't truly understand different cultures, different backgrounds, different ethnicities. We don't all get trained in that way. Now, to your education question, I also believe there's some other things we've got to do at the educational level. First of all, I don't think anyone should come through any healthcare program at all levels, allied health all the way through, without really understanding what it means to deliver human-centered care. And when you look at it today, we have a system where, matters like empathy, important matters like compassion get kind of talked about, but not really trained on in the same way that it really needs to. And I would couch the issues of like health equity, which are so important, as part of those matters as well. We've actually struggled in healthcare. I mean, even before the pandemic, but post-pandemic, we've had so many challenges when it comes to really that human connection within our healthcare system. And it's not the workforce's fault. Part of it is because we have them doing so many technology related things. They're taken away from the patient time. I look at like my doctor's office as 15 minutes, 15 minutes, 15 minutes. That's not a good system to truly have, good provider patient communication and care. So we have a lot of work to do in this space. And the final point I'll just make, and I regularly talk about this, I am always offended when I hear people say, well, we need to have a resilient healthcare workforce. I believe in all my heart, as somebody who grew up as a son of a nurse and someone that's worked in hospital administration, I have never seen a more resilient workforce than healthcare. What we need to have is we need to have a sustainable workforce, and we need to have a culture and an organizational environment that allows our healthcare professionals to feel cared for, encouraged, appreciated, valued, and supported. And when we do that, we actually have a sustainable workforce. That's the type of work we got to do in healthcare.
Yeah, I think you touch on a lot of valid points. And when I listened to what you just said there was a word you mentioned there, and empathy, right? And I'm going to use myself as an example here because I think that maybe this is an issue that we're dealing with more and more. So I think for my life, I always dealt with, I had issues with my weight. I was on
Mm-hmm.
heart medication. I was at one point, I was well over 100 pounds overweight, right? I was close to 270 at 5'5", too much, right? Um, you know, I had a lot of doctors. They were so nice. Everybody treated me with respect and with empathy. I would say they cared. And I think there was a point there where they were so afraid of hurting my feelings that maybe they were doing me a disservice. I
Mm-hmm.
finally, years ago, I went to a doctor, and I've told this story before, but I'll tell you now. He literally asked me if I had 8 friends. And I said, yeah, why? He said, you're going to make a heavy coffin if you don't get it together.
Oh, wow.
And I kid you not, that was it. I lost over 100 pounds. I'm no longer on heart medication, right? So, like, is there, when it comes to the education, the empathy, right? Do we sometimes, maybe part of it is understanding better and training doctors, nurses, maybe on delivering some of these harder messages that are harder to deliver because I feel like they're almost afraid to. And listen, I blame our society too because I think we're such a legal conscious society. Like
Yeah.
people get offended so easy. Somebody might have your best interest at heart, but they're going to come at you like, what do you think of that?
Yeah. Look, I think, ultimately empathy, empathy in the construct of it is really, the idea of delivering a message that shows care and concern for you. And so at the end of the day, there's nothing in what that physician said that would be offensive to you. And ultimately, you know, there was probably, I would imagine, a process that he went through in kind of delivering that message to know that hopefully that would resonate with you. I do believe, though, to your point, that we've got to do much more training. And I look at great organizations, if you've never heard of them, some people may not have, of the Gold Foundation. The Gold Foundation's work is really amazing in this space. And, I think, they've always had the tagline of redefining, healthcare in a human way and really bringing humanism into healthcare. And I think at the end of the day, that's what this is about. I look at it like this. I mean, like you, at one point, I was over 100 pounds heavier too. Now I'm 6 foot, but I was 276 at my highest, and you know, I did not necessarily have somebody who said it as direct as that, but I do believe that we've got to train our healthcare professionals to be able to communicate with one another and with patients in a way that resonate with them. And that gets to the point of health literacy, actually,
Mm,
which I will argue, as somebody who even has taught at the graduate and undergraduate level of healthcare programs, we don't really teach enough on,
mm,
because we've got a very, very different population in the United States, which means we've got to communicate with our patients in a way that resonates with them, not with how it resonates with us as a clinician. I'm not a clinician, but with our clinicians, we've got to communicate in a way that helps them to understand it. And so that physician, was able to reach you in a way that you clearly walked away and said, I'm going to take action. For some people and some cultures, if they would have said that, if that same physician said it to them, they would have been very offended. And so it is a matter of thinking through and, again, training around those things. We This is how we advance not just health equity, but it's also how we advance quality outcomes. And to that point, I mean, it's amazing to think, right? You're not on that heart medicine, you're much healthier, and what that physician did for you had a great impact. That's the type of healthcare culture we want to be thinking about, is what do we do to help people take accountability and take action? But it has to be very personalized,
mhm.
without question.
Yeah, I couldn't agree more. I mean, I think you're right. I think to your point, it's knowing your audience, so to speak, as we in any walk of life, you have to know your audience. As you talked about that, I start to think about the way our healthcare system is set up.
Hmm.
I feel like there's definitely an area where we could become a more cross-functional healthcare society where we have the doctors, the nurses working alongside potentially the dietitians, the fitness, all of it. Like, do you think we're missing opportunity to start to build these levels of healthcare where it's more of a cohesive front and we treat the full patient?
100%. And it's even fractured in how we teach in the education side, right? Like the fact you have dental school and medical school and nursing school and pharmacy school. I think so much of that is very systemic. It's just been the way that it's been for so long. And what we've seen is when we knock down those silos and have true interdisciplinary education and practice, we see great results for both the workforce and patients. At my former healthcare system, for example, we had an amazing program that was developed by uh, based on another healthcare system, but it was really then we learned of that model and then we developed it internally. And, we developed it with a team of physicians, a team of nurses, a team of case managers, a team of social workers, a team of pharmacists. And ultimately, it was a health coaches program that then became an actual program at the local university. And what was awesome about it is then we actually brought students from pharmacy, nursing, medical students, allied health, athletic training, and you name it. And ultimately, this team of students would go out to patients that were super utilizers of our healthcare system and would work with the patients to understand how we could reduce them being super utilizers. And what we found in that pilot project, which was actually funded by a payer, which was so cool, we found that that interdisciplinary program that was pre-professional actually, because the folks that were going out were not actually full, finished with their program, was so impactful that we were able to knock down the emergency room visits from those super utilizers, so much so that we saved, thousands to millions of dollars. And and we were training the future workforce on interdisciplinary care and practice. And so, I think and I'm encouraged because I've seen this even when I've been at the AAMC recently conference and such. I'm seeing more and more of a movement towards that. But and see, certainly AMA has as well been, talking about these things. But we definitely have to, because when you think about like dental, the idea that it's separate is crazy because so much stems from oral care, diabetes, heart disease, like so much is so interconnected. And the idea that we still have it separate from a payer end and separate from a provider, and then in the education side, it just doesn't serve our patients right.
Yeah, and that's encouraging what you just talked about. I love hearing that. I think that's fantastic. That's really cool what you guys did. Did you guys have there been any questions, or has anybody asked to potentially utilize that or try to utilize that more in other areas of the country?
Yeah, I mean, so that program was actually when we built it, um, was based off of a healthcare system in Western Pennsylvania. And I know that there are definitely other kind of similar programs at many different healthcare systems, kind of in their own specific form. Some are focused on like street medicine, some are focused in, the super utilizer space. Ultimately what it comes down to, though, is an investment by the healthcare system to try those types of things, right? There's a lot of good work occurring in the community health space, but we have to remember that sometimes with these programs, it takes time for them to achieve the outcomes.
Mm.
In our case, when we were acquired by then our future, parent healthcare system, they didn't have the same appetite for that program as we did when we were an independent system. And so while it exists today, it's still not run in the same way that we did it. And that's unfortunately what I've also seen in healthcare is as we become larger, sometimes we become more removed from the communities that we serve, which is why I strongly believe that every healthcare system has to be an anchor institution in the community that they serve. And that as a healthcare system, they have a responsibility to take care of the needs of their community. And that's what I always had. That was my experience in a regional community healthcare system. And I strongly believe that's the experience we should all have.
Yeah, no, I agree. And I do think you said something a little while back there, but as far as it being fractured, to your point, the fact that you have to have your dental insurance, your vision insurance, then you have your health insurance, and then it just it's it's definitely confusing. And I think that a lot of people, especially in this day and age, hate to say it, but you start to go, okay, well, I'll have the overall healthcare insurance, but I can't afford the dental, or I can't afford the vision, or even when I go and I use it, it costs too much. I think there's a lot of work we could do as a society to get that better. I'm not advocating for, because I have some relatives who live overseas, and I hear nightmare stories about their healthcare system. So I don't think that's the route to go either. But I do think there would be more, we'd be better served if we could kind of get things tightened up. I was just talking the other day about this to my wife, actually, about how when you think about the way it's structured now, how do you feel about the push now for, I feel like it's a push anyway, for the urgent care setup, where, it used to be your primary care, at the very least, they were the ones who led the way. But nowadays, you're lucky if you can get an appointment 2 to 3 weeks out, and they'll send you off to urgent care, who they end up basically getting you to see a specialist or someone. What do you think about the way we're going in that area?
Yeah, I don't think it's a good approach. I mean, urgent care by in of itself was developed and set up to be, just that, an access point when you can't see your primary care provider, which obviously would be evenings and weekends. And that's how it was set up. I mean, that's how my former healthcare system set up. I, in fact, was on our expansion team when we built our urgent cares. I think every healthcare system has to really sit back and really reflect on their primary care strategy. And certainly we have a shortage of primary care physicians coming out of programs. And certainly there's we're about to even get worse because of retirements. But we've got to have a strong emphasis on having primary care providers at all levels, physicians, nurse practitioners, physician assistants, etc., because that's still the best route for people. I do see great value in urgent cares, again, for those evening and weekend situations. But an urgent care is not there to just, refer. An urgent care is to meet the needs. And if they can't meet the needs, send somebody to the emergency room so those needs can be met. And in many cases, the urgent care is there to also help address the more minor care issues that you would not want to go to emergency room for.
Mm.
And so we have to remember the right intention for these services. And certainly, I think part of the challenge is, and it's not just hospitals that have done this, the independent groups that have done this, there's been such a move, again, because healthcare is a commodity in the United States, to just offer services that are going to drive volume. At the end of the day, the best situation for a patient is to have an established care practice with a provider that gets to know them, understands their family history, understands, when they've had testing or vaccinations, you name it. That is not how urgent care is set up. Urgent care is set up to be episodic. It's not set up to be routine. And so we've got to make sure that we have a routine process.
And Jeff, do you think because of the way it's set up now, and maybe it wasn't the intent, but the way it's going, right? Do you think that, unintentionally, do you think the healthcare system is maybe opening themselves up for a something bigger as far as fracturing it even further, right? I've read some interesting studies where they're feeding data into AI, and the outcomes they're getting based on data and the way they're doing it is performing at extremely high levels, almost the equivalent or better than some primary care. Do you think that if we don't change, we're running the risk of maybe the way this works is we're more focused now on putting the care in the hands of AI and even things like telemedicine?
Yeah, I think there's always great risk for that. And, what I'll say about that is, I mean, again, we need to harness the power, certainly, of AI in a safe and equitable manner as it relates to any aspect of medicine. But we can't, we certainly cannot allow it to replace the most critical part, which is critical thinking and evidence-based practice. It can certainly serve as a great amplification and also as a great assessor and like a competency-based type of approach to assist a clinician with making sure that we're driving, high quality outcomes. But ultimately, we must continue to have a system where human touch, human-centered care, human interaction is still paramount. We saw, particularly during the pandemic, that telemedicine has its place in hard to reach populations, particularly when it comes to matters that are easier to diagnose or easier to manage in that environment. But we also saw that it has its challenges too. I mean, think about diabetic patients. We saw during the pandemic in some parts of the country that some individuals of their diabetes needs got much worse during the pandemic just because a provider or a clinician wasn't able to actually see the patient and see that that their condition had worsened to a point, and ultimately they had to lose a foot, for example, through amputation. Well, that probably would have been prevented if in a situation where they may have, been able to see them more routinely in person. And so there's a place certainly for telemedicine. I mean, one space that I certainly have been encouraged by is telepsychiatry.
Mm.
Because again, when we have such a shortage of mental health professionals, and certainly it's not getting better anytime soon, telepsychiatry plays such a vital role of providing access and certainly providing care that can lead to medication that can allow people to better manage their mental health. That's a space that, I think we're going to continue. It's also a space that I don't believe AI can be a solution necessarily. I think it can be a partner in the solution, but it cannot replace entirely. That's the type of stuff I think we got to be paying attention to.
Yeah, I mean, kudos, man. That was very eloquently stated. As you were saying that, I already was thinking how that's going to make a great clip for this episode. No, well done by you. I think that was a very good way of putting it all in perspective as far as AI and healthcare. So kudos to you on that one. Um, one last question, kind of about healthcare, and then I got a couple other things I want to ask you, but I want to ask you this because you mentioned it. I believe you said your mother was a nurse practitioner.
She's a
Um,
nurse. She is a
she's
nurse. Yeah.
a nurse. Okay, are we losing opportunity there? I feel like, again, I was just saying this today. My daughter has to go to the doctor. Last time we were there, we saw the nurse or nurse practitioner. Like, I feel like sometimes they're underutilized or they're utilized in a way that we're not giving them their proper due. And I think that there's more there for them to do as far as the way this is all set up. And I wanted to get your opinion on that.
Yeah, I think first of all, nursing is at a, has been and continues to be at a very challenging time. We've expected our nurses, particularly on the hospital side, to do so much, and frankly, with so little. And part of that is we've got a significant nursing shortage. We've got a lot of retention challenges. We've got a lot of culture issues, and you name it, so many challenges there. But I do think, without question, I mean, the backbone of our healthcare system has always been our nurses. I mean, back in the day of, Florence Nightingale, all the way through, nurses have always been by far the backbone of our healthcare system, and will continue to be because it's if there's one area of healthcare trained extremely well in so many areas, it's nursing. Now, obviously, it has opportunities just like anything, but nurses are trained extremely well. And generally, when you think about it, they also bring such love and purpose and passion into the work that they do. I do believe, and we've seen this, that there are greater ways for us to leverage the power of nursing in the ambulatory footprint. And we've seen some of that. We've seen LPNs in our physician practices, we've seen RNs in our physician practices. And certainly it can elevate the care, and it can also provide a great opportunity to build career pathways. Because when you think about a medical assistant, one of the best career pathways is from an MA all the way to become a nurse. We've got to be thinking about these types of matters. And sometimes for someone to have that dream come true, they've got to see somebody else in that environment that they could feel like they could be a part of. And the other point I'll just highlight is we one of the challenges we have when you think about nursing is, nurses are paid far less than so many others, within the clinician space. And yet, again, are expected to do so much.
Hmm.
And so we're going to have to really be thinking about these matters because it's one of the reasons why we've seen sign-on bonuses, we've seen retention bonuses, we've seen different things. But we're going to continue to have to reflect on what it is the future of nursing looks like to the future of medicine, et cetera. But no one can argue the impact and the power of nursing, and it's usually almost every year one of the most trusted professions. And obviously, I see it as somebody who is the son of a nurse, but also my first CEO was a nurse, and I look at what our culture was like under her leadership as a nurse compared to what it was like under the other CEO. Very, very different culture. Very supportive, empowering, valuing, appreciating culture, and so our nurses are truly amazing.
Yeah, great segue too. The next thing I wanted to talk to you about was leadership in the space of healthcare and our healthcare leaders. I know earlier you mentioned about healthcare being extremely resilient, which I agree with. I would say this: I think the leaders in healthcare have to actually have another level of resiliency in order to do what they need to do. What are your thoughts on leadership, resiliency in the whole healthcare space?
Yeah. I think we're really at a significant crossroads here, right? I mean, we certainly have a significant challenge with culture in most healthcare organizations that has led to probably one of the most challenging times from a recruitment and retention perspective ever. And it was not brought on by the pandemic. A lot of people want to blame the pandemic. The reality of it is that healthcare has been a space for so long that you didn't necessarily have to worry about recruiting. There was such strong interest to want to work in healthcare. And over time, that interest has dissipated because there's been so many different things that have happened. For example, violence from patients to the workforce is so much higher than it's ever been before. In addition, you've got the culture issues that I've talked about. And, I think when it comes down to it, at least in my experience, and also as somebody who's studying this as part of my doctorate right now, healthcare is a space where we haven't truly focused on what it means to be a really effective leader in it. And it's just been my experience professionally that when you have a culture that truly values its people, you see a much different approach as compared to a culture that seems to be, you know, acting like they do, but they really, really don't.
Mm.
And I regularly say, most organizations do employee engagement surveys, and a lot of them feel like, well, if we do that, we check the box. When it comes to culture and when it comes to taking care of our people, we can never view anything as checking the box. It has to be intentionally focused on lifting one another up. And today, you look at the issues of burnout, we wonder why we have burnout. Ultimately, it's all tied to culture. It's tied to how people feel, that if they value, do they matter? And one of the things I talk a lot about now, particularly in healthcare audiences, is the idea of belonging and mattering.
Mm.
Because if you have a sense of belonging and you know that you matter, then normally you're not going to want to leave that environment. It's a culture that you're going to thrive in.
Mm.
But we know people leave a job because of their manager, 9 times out of 10. And I will argue that in healthcare, that statistic is even higher. We have more and more people leaving because of a bad manager. And so we have a lot of work to do to improve there. Now, some people will say, well, what's the solution? One of the things that I think has to happen is we've got to do more leadership development earlier. We've got to be educating and training people to understand what it is like to lead, and
Mm.
then really create that right career pathway that can achieve that. We have not done that as well as we need to.
Yeah, it's so interesting and again, well stated by you. I love talking about leadership on this podcast. On a recent episode, I'll throw a stat at you that I learned. It is mind-boggling to me, but the typical we're worldwide, they're wasting $8 trillion on the old, outdated leadership type playbooks throughout corporations around the world. And I think the other issue when I hear you speak, and it just makes me feel stronger about it, is I think sometimes we have an authenticity issue from our leaders, and not just our leaders. I think sometimes our leaders gets that from the top down. And let's be honest, right? I mean, let's say it bluntly, people see right through BS. And if people below you give an indication that you're full of it and you're not authentic, you're going to have a hard time gaining that back. One of the other things I love to say is trust is our currency.
Yep.
And once we lose that, regardless of the space, I think we're in trouble. Well,
Yep.
Jeff, I wanted to give you a chance here. I was on there yesterday and today, but you got really, really cool website going. Could you talk a little bit about what that website is and what the goal of it is?
Yeah. And I think are you referring to the market scale page?
Yes.
Yeah.
Yes.
So I have had, certainly, the privilege of partnering with Market Scale both to host a podcast and dialogue on what I call holistic leadership, which really, is focused on the idea that if we're going to be successful when we lead others, we're going to be successful when we lead them with the mind, body, spirit involved. And as part of that, I've also had the opportunity to contribute to many different, important dialogues around anything associated with education and medicine. And so, sort of the eds and meds has always been a space that I've been engaged in, really because it's a space that my mother kind of inspired me as a young child because obviously as a nurse she finished her schooling when I was 5. She was a single mom and achieved her dream when I was 5 years old and did so as an immigrant from Germany. And so as a first generation American, I that's always been a space that I believe, certainly, and especially when we talk about healthcare, education and healthcare are synonymous. They're so critical together. But I believe that the biggest challenge facing both really comes down to leadership. And certainly we have a lot of work, as you just stated, to do. And I think healthcare, to your exact point, which was so well stated, is a space where we've approached leadership in a very old way of thinking. And we haven't approached it in a way that we keep in mind the 5 different generations. And so in the work that I do, try to remind everyone that, now is not a time to sit and judge what a millennial does or what a Gen Z or Gen Y does. That, frankly, we're just dividing when we do that. Now is a time to find out what each of us brings into the workplace and create the best possible economic engine of a workplace that creates a sense of belonging, makes people know that they are valued and that they matter, and ultimately drives all of us to perform at the highest levels to have impact for our patients and our colleagues around us. And I do believe that there are some great examples of leaders that do that, and I do think that it's possible. To your point, when we bring our authentic self into the space.
Man, that was what a great way to end it. Great. Kudos to you again. Very, very, very well said. Well, that being said, I've enjoyed this. This is kind of, again, being in this healthcare data space, I'm now like 30 plus years. I enjoy having these conversations with folks like yourself. So thank you for that. Last thing, besides the website, anywhere else folks could find you or anything you have coming that you would like them to check out?
Yeah, no, always happy to connect on LinkedIn. Great place for obviously connection and community, and always happy to talk.
Awesome. Well, everyone, thank you so much for tuning in. I personally enjoyed this conversation with Geoffrey. I hope you all enjoyed it as well. Geoffrey, I tell people all the time, I think nowadays I do the podcast almost for selfish reasons. I'm trying to just continue to learn myself. And along the way, I feel like it's impacting others, these conversations. But truly, I can't lie. I think it's as much for me as it is for them. So, again, thanks for educating me and making me be a little bit better than when we first started this conversation. So, thank you very much for that.
You're so welcome. Thank you as well for all that you do.
Thanks again, everyone. Really appreciate you tuning in. Take care, and please check out Geoffrey and the things he has going on. Connect with him on LinkedIn.
This has been the Bare Essentials. Thanks for listening, and remember, never hibernate on your goals.